Hello, everyone, and thank you for listening to IFFGD's Illness Experience Program. The information and resources shared during this podcast should not replace any medical care you are currently receiving. It's important to always consult with your doctor or other healthcare providers before you make a decision about your treatment. So, for today's program, we are speaking with Tyler from California. He is a 26-year-old, and we're just going to speak with him today about his patient illness experience. So, Tyler, will you please tell us a bit about yourself?
Yeah. As you mentioned, I'm currently in California, but I'm originally from Colorado. Um, and in 2011, I suffered a spinal cord injury that left me paralyzed from C3, or left me paralyzed at C3, C4. So basically no movement from the neck down. Um, and since the accident, I've just kind of bounced around all over the country. I spent 4 years in North Carolina where I did my undergrad degree at the University of North Carolina, Chapel Hill. And then for the last 3 years, I've been out here in Los Angeles. I did my master's at USC. And then I've just been kind of out here looking for work and working on projects as I try to find my little place in the world. So that's kind of the short rundown. I'm happy to give you more details on anything, but that's kind of the short rundown of who I am and what I've been doing since my accident in 2011.
Well, thank you so much for sharing that with us. So often, people who survive spinal cord injuries, also known as SCI, may suffer from long term effects on other parts of their body, including the gastrointestinal tract. As we mentioned before, today we will be speaking with patient advocate Tyler, and we're going to gain a little bit of a better insight on his illness experience and why it's important to raise awareness about spinal cord injuries and its association with GI disorders. So, Tyler, can you briefly tell us your backstory a little bit and share what you have been clinically diagnosed? I know you did that before, but if you could just go into a little bit more detail with it here.
Okay. Um, so I have been clinically diagnosed with C3, C4 spinal cord injury. It also what's called Asia C, incomplete injury, which means that I don't have a full severing of my spinal cord. So I have some form of sensation and feeling below my level of injury. Um, and that all came from a vehicular accident when I was 17. Um, I, as far as other diagnoses that I have, like spinal cord injury kind of comes with a large array of things that you have to pay attention to in order to like fully live out your life. Um, and some of those things are you got to pay attention to your skin, how you regulate your bladder, um, a lot of it is your food intake because you don't your body doesn't process things as it used to. So um, like I know that for me specifically when it comes to things like GI, I've had like suppressed appetite, and so one of the things that I've had to do is I drink more protein shakes on a regular basis, and that's to help with my skin and also with um, just kind of retaining muscle mass. Um, I've had like issues. I have this undiagnosed stomach pain that I kind of deal with, and we don't know if it's GI related or if it's the fact that I have a suprapubic catheter, which is another way to void your bladder. I also have a baclofen pump placed, so I have a lot of tension around my stomach. So it's one of those things that I'm constantly kind of in some varying level of stomach pain that we've tried to diagnose and haven't really found the answer to yet. Um, and so these are all just kind of things that come with spinal cord injury that you constantly have to be paying attention to and um, really, uh, I would say, kind of be a fanatic in the way that you research your body and your care. Like I know my mom is constantly doing research and sending me articles on different medical practices that could help me further understand my care and things that I need to do to improve my everyday life. Um,
Yes. So it's probably more so like being a full-time like researcher for yourself. Would you say?
yeah, yes, definitely. I think that that's a great way to put it because um, it's something that I kind of struggle with, but I'm lucky to have my mom there to help me with like and friends too. So as a little example, I recently had a pretty bad kidney stone situation, and it just got cleared up after like 4 months. So I had two surgeries, a hospitalization. I had all these things going down, or all these severe medical complications because of kidney stones. And I've been taking cranberry pretty um, religiously since my accident because I have a suprapubic catheter. So cranberry helps with keeping the bladder clean and all of that. But one of my uh, care assistants, she told me she recently found a research saying that cranberry supplements can help lead to kidney stones. And so, since my recent kidney stone issue, I've taken cranberry out of my daily medicine because it's one of those things that as your body continues to change throughout your injury and regulate. Sometimes you need to know that this medicine that I was taking that was so helpful for me is now something that could potentially cause me harm. So it's just constantly researching and finding new things and new ways to take care of your body.
Right. Yeah. And just what you were saying too, just also having your mom and other friends kind of supporting you in that way to kind of help you with that research. I'm sure that also is very helpful and beneficial for you to know what other research topics are out there. And part of that, what else have you learned about the connection between spinal cord injuries and GI conditions that you might feel is most important to raise awareness about?
Um, I would say the most important would be in this goes to the bigger picture of spinal cord injury is regulating your GI. It's getting a program that works for you. So what I've found works for me is I do an everyday or an every other day bowel program, and I use what's called enemies, which are like mini enemas, to help me out because um, I had a for a long time I really struggled to regulate my program, and I would go every day, and I was going through a lot of really harsh systems or a lot of really harsh medicines. And so it's really finding what works for you and making sure that you do that because if you don't take care of your GI, like I've ended up hospitalized because of my GI, where I had to like um, do a full flush because I've been so backed up and constipated. So it's really just making sure that you take care of your diet and also finding that program that works for you.
Yeah. And then also, I know we talked a little bit about your support system, right? And how your
Mhm.
mother, how your friends help you with the research. But what are some other obstacles that you have had to overcome that you feel the support from your family and friends really helped you through those challenging times?
I think the biggest one, and there's a million of them, right? Because the only thing that I don't need help to do is to think, because everything else in my world has some sort of physical aspect that I need help with. Even today, my assistant, who's also my friend, he's the one who helped me get on this phone call because I'm stuck in bed and can't use my iPad. So there's so many things that you need help with, but I think the thing that my good friends and my family did that was so important was, especially directly after the injury, when you feel like such a fish out of water, having that support group there to ensure that you're going to have reliable and dependable care, and someone that's going to treat you normally, it's just so important. Like, one of the things I give my mom a lot of credit to is I didn't I never really got the chance to um really w- wallow in my injury, because the way that my mom helped the transition occur was, it just seemed like, on Tuesday I was going to baseball practice, on Wednesday I got injured, on Thursday we're just dealing with it. So I was still watching movies. I had friends coming to the hospital to visit me. There was there was no lull. So even though I was dealing with new challenges and something that in itself is rather tragic, we never allowed, or thanks to my mom, that we never allowed something that was tragic to become a tragedy and overwhelm our lives. It was always about surrounding ourselves with people who made us laugh, who um, could comfort us when we cried, could bring back that sense of normalcy that you had before your injury. Not because it you need to hold on to your life as it was beforehand, but you just need to not lose who you were in your life beforehand. And I think that friends and family play such an important part in that.
Yeah, and I think you really a powerful statement that you made, and I think that will really can really help other patients and give them more encouragement through challenging times. Is that even though sometimes we face, like what you said, tragedy, it's so important for us to not make it become so traumatic, or for it to overwhelm us, should I say, consume what we are going through, and to try to see the positives in a lot of things. And just what you said, having that support system can also be very beneficial. So in part of that, I know you said that it has shaped you, but in what other ways has your illness experience shaped you into the person that you are today?
um I think one of the big things it's done is it's really slowed down my world. And one of the things that happens, for better or worse, with spinal cord injury is sometimes you get pushed to the outside of a circle, just because it's not always easy to be directly in the middle and be the center of attention. And what that does is it gives you an opportunity to, if you choose to take it, to watch and observe those around you. And so I think through that, I've become a lot more um, introspective, and uh, I've learned to watch and evaluate those around me, and because of that, I've become a lot more sensitive, because I'm not just doing, I'm not just constantly um, caught up in the energy or the excitement in something. Sometimes I'm outside of that energy and I'm outside of that excitement. So it's allowed me to become a lot more sensitive and a lot more thoughtful, and recognize things that other people are going through, especially because I'm going through things that I've never gone through before. Like, one of the things that I talk about is I come from a upper middle class family, and I never really faced a lot of challenges or adversities in my life. And so learning to overcome those has made me more sensitive to those who have struggled longer. And so it's made me, I think, not to say that I wasn't a sensitive or empathetic person beforehand, but I think it's given me a new understanding to the challenges that everyone faces in their day-to-day lives, and how to be a better ally to those people who are struggling and those people who need a helping hand. It's helped me empathize with them more than I maybe had beforehand in my life.
Yeah, and I think that that's one beautiful thing, especially about the patient community, is just that end statement, being a community and being there for each other, supporting each other. And I think that that's very powerful, for you to say, even in your circumstance, that you are still able to empathize for others. And that's a powerful statement that I think anyone can take away from. So, as we begin to kind of wrap things up, do you have any advice or maybe words of encouragement that you would like to share with anyone who might be listening today?
Um, Specifically when it comes to spinal cord injury, and this goes to people in general, but speaking from my experience, the thing that I would want to tell people is that you are not a burden, and you should not feel ashamed for asking for help. It's something that even to this day that I really struggle with, and I think a lot of people with spinal cord injuries struggle with, is constantly asking for help and needing support from others can sometimes make you feel as though you're a burden, you don't want to ask for help. But I think one of the things that I've learned is that the people in your life who are still there and care are excited to help, and they're open to helping you, and they want that opportunity. And don't let your own pride, your own fear get in the way of furthering or deepening those relationships, because of some self-conscious uh, thing that you're holding on to around your injury. It's pe- People are genuinely good and want to help you, and allow them to, and allow them to, and allow them to be there for you and be open to that, because I know that's the thing that I've struggled with most in doing, and I still don't always do that, but I try to remind myself of that, so that way when my new friends in my life or a new person in my life is trying to help me with some facet of my care, I try to remind myself to be open to it, even though it's something I'm not comfortable with.
Yeah. And it's like becoming comfortable with those uncomfortable things. And I know that that's even advice for me, being that it's not always easy to ask for help. And I think that is tremendous advice, that you aren't a burden, and it's okay when you suffer from any illness, and specifically being spinal cord injury. I think that that's a very powerful statement, that you're not a burden and it's okay to ask for help.
Yeah, I think that would be my biggest takeaway of the things that and like I said, it goes to everyone. If That's why I said it's a spinal cord injury thing that I learned that message through, but it goes to anyone. If you're having mental health problems and you feel alone, don't be afraid to talk to someone, because you have someone in your life who listen and and help you out. And so it affect it. I learned it through a different means, but I think it's pretty. I think it affects everyone and something everyone should know.
Yeah. Thank you so much, Tyler, for sharing your insights on this topic. And thank you for just taking your time to speak with us today. And thank you, everyone who might be listening to IFFGD's Patient Illness Experience program. Um, and again, we just really appreciate Tyler for sharing his story and raising awareness about spinal cord injuries and its association to GI disorders. We are tremendously grateful for Tyler and for him sharing his unique insights. Thank you again.
Thank you for having me.